In this video we will talk about causes and types of gallbladder disease. Don't forget to like, share and subscribe to our YouTube channel to be notified when we upload new videos daily. The gallbladder is a small organ that is situated in the vicinity of the liver. The liver produces bile, a substance that has a very important role in the digestion of fat. The gallbladder stores the bile produced by the liver and expels it inside the small intestine when the substance is required in the digestion of foods containing fat. Many people suffer from gallbladder disease these days. The disease has a high incidence in elderly people, and statistics indicate that around 15% of people with gallbladder disease have ages over 50. Gallbladder disease mostly occurs in women, as estrogens facilitate the development of the illness. Children and teenagers rarely develop gallbladder disease, and young patients usually suffer from milder forms of the disorder. Gallbladder disease has a high incidence in overweight people, people with internal disorders, gastrointestinal problems, and people with high blood cholesterol levels. In the majority of cases, gallbladder disease is caused by gallstones. Gallstones are formed due to the excess of cholesterol in the bile or incomplete emptying of the gallbladder. Sometimes, gallstones are formed when the gallbladder removes too much water from the stored bile. Gallstones are solid formations that accumulate inside the gallbladder, blocking the access of the bile. The diseased gallbladder can't sustain its normal activity, and the process of digestion is perturbed. Gallbladder disease can usually be overcome through diet and medical treatments. However, in serious forms of the disease, doctors recommend the removal of the diseased gallbladder through the means of surgical intervention. Gallbladder disease can be either chronic cholecystitis or biliary colic, or acute cholecystitis. Chronic cholecystitis is less serious and generates milder symptoms, while acute cholecystitis may in some cases require surgery. The gallbladder is not considered to be a vital organ, and if it is removed, the body can still sustain its normal activity. However, in the absence of the gallbladder, the liver has to produce more quantities of bile whenever food that contains fat enters the small intestine. Without a gallbladder, food digestion and absorption can sometimes be affected. People who had their gallbladder surgically removed need to respect a low-fat diet and limit the amount of food consumed during their meals. With appropriate medical treatment and good diet, the body will begin to cope with the absence of the gallbladder. There are two common medical procedures used in gallbladder surgery: open surgery, cholecystectomy, and laparoscopic surgery, laparoscopic cholecystectomy. Laparoscopic cholecystectomy is usually preferred by both patients and surgeons, as the surgical intervention involves less risk and leaves less pronounced scars. This form of surgery is performed with the aid of a laparoscope, a tube-shaped medical instrument that has a camera attached to it. By using a laparoscope, the surgery requires smaller incisions, and patients who suffer such surgical interventions recover rapidly. There are many effective means of dealing with gallbladder disease, and it is important to see a doctor if you suffer from gallbladder inappropriate activity. Left untreated, gallbladder disease can aggravate and lead to complications. I hope you found some useful information and tips. I look forward to hearing from you. Warning: none of the information on our videos is a substitute for a diagnosis and treatment by your health professional.